with okay. In the last piece of Children's Corner, okay, Prof. Renner wanted.
So yes, Dr. Adi and myself, we thought we should entertain you, as she said, and she opened with the first piece of this, and she left me the second piece, and she said, you need to wake them up after the lunch break. So let me see if I can help waking you up, and enjoy, and I hope you will be wide awake afterwards.
Okay, to Professor Reinhardt, please. Wow, really outstanding performance. Thank you, Professor. And then one more time, I think that we have to give Professor Renner one more time applause. Okay, thank you. Ladies and gentlemen, it is time for our third session of the symposium. The topic for this session is health sector strategies to prevent and control NCDs. There will be some prominent speakers presenting the issues covered the topic. And to guide the session, may I invite Professor Dr. Siswanto Agus Wilopo, Master of Science, to be the moderator. to Professor Siswanto, please.
Good evening. Let me invite the first speaker to be on the stage, Madam Dr. Hernani Jarir. Come on up, please. And then representing Professor Chandra is I forgot the name. Dr. Prima? Yeah. Dr. Prima Yusufin. Ladies and gentlemen, the third session on this seminar is the topic is Health Sector Strategy to Prevent and Control NCDs. I guess it is my honor to be here to moderate our speakers this afternoon. And on my left side, Dr. Hernani is actually my classmate. She was my good classmate, so we were on the same room every night, you know. So we had a good memory at that time. And my right hand side is Dr. Prima Yusufin, which this is my first time to meet you. Of course, it's my pleasure to be able to moderate your presentation. Given the time is so limited, only about an hour, I would like to ask Dr. Hernani to present his thought about 20 minutes and yourself is about 20 minutes so that we can have time for discussion after the presentation. Now, I invited Dr. Hernani, your time is yours. You may stand in the podium there if you wish.
Yeah, better.
Oh, you okay, better. Okay.
After long. Yeah. Thank you, Dr. Siswanto. I'm really happy to be here with all of you on behalf of WHO. So good afternoon. First of all, I would like to thank University of Gadjah Mada for inviting WHO to be here in this symposium. Indeed, this symposium is very important. I mean, it's a reflection of the university concern on the prevention and control of NCD in Indonesia. So here is my presentation. I will start with the background. So if you can see here, in 1999, WHO reported that in 1997, about 33% of the death, global death, caused by NCD, caused by communicable disease, and then 29% about the circular diseases, cancer, COPD, and perinatal. From this graph, you can see that the death from NCD is higher than communicable disease and perinatal condition. Oh, okay. Because I'm not a singer, so it will be okay. So from this graph, you can see that. Oh, sorry. Oh, sorry. Okay. Sorry. Yeah. Oh. No? Yes, okay. So this is a reflection of the global death. So you can see that the death from non-communicable disease is higher than communicable disease and perinatal condition. So here you can see that this is about the non-communicable disease compared to perinatal and other. So the need to provide effective public health response were recognized in WHO in 1998. They asked WHO to prepare a global strategy. Then the global strategy for the prevention of non-communicable disease has been endorsed in 53rd of World Health Assembly. So after that, there are a lot of activities has been done by WHO, starting from global strategy in 2000, and then FCTC in 2003, and then the biggest achievement is in 2011 with the political declaration on NCD discussed in the UN Global Assembly. Yeah. So after this political declaration, so it means that the NCD will be bring into the UN discussion. So WHO in 2013 prepared WHO action plan for the prevention and control of NCD in the second period, because the first period is in 2008-2013. So, talking about the burden of NCD, here is the graph showing that the mortality trend from various diseases from 2008 to 2030. So the trend of cardiovascular cancer and chronic obstructive pulmonary disease is increasing significantly if there is no intervention effectively implemented. So this is again the same burden of NCD. If you can see here in the graph, 63% of the global death is caused by NCD. So we can say that the NCD is number one killer, and also we can see also 3 out of 5 global death is caused by NCD. So this is among the NCD itself. You can see here that cardiovascular disease, which is in blue, is the highest cause of death, with a 39%. It's around 1/3. So this is again the variation of the NCD death among several countries. So you can see here in the graph that disparities on the NCD death was exist across the country, with the highest in the Marshall Island country, and then the lowest in Japan, which is only around 10%. So this is again the cause of death. If you can see here that most of the death around 30 years old till 1969, it's around 14.2 million a year. So, and mostly in low and medium income countries. So this is the figure in Southeast Asia region. So you can see here that almost the same figure and with the global situation. So this is in Indonesia. You can see here that non-communicable disease is increasing significantly from 1995 till Riskesdas 2007. So if we talk about the cause of death, again cardiovascular in Indonesia also is the biggest cause, is around 31% of total death. So talking about NCD morbidity, I think everybody understand that the morbidity data is important for the management of health services, and also for planning and evaluation of the health services delivery. Unfortunately, reliable data on NCD morbidity are unavailable in most of the countries. So the most comprehensive morbidity data is related to cancer. The data is available from the population or hospital-based cancer registry. I think Indonesia is already implemented in one province in DKI Jakarta. So this figure is also can be as a sentinel to see what happened in Indonesia. Regarding the disease registries for diabetes, hypertension, and renal insufficiency, in a well-resourced setting such as a big hospital, so the data is available, yeah, rather than in the entire population. However, data on the prevalence of diabetes and raised blood glucose are available from the population-based survey. WHO has already started to use a step survey to collect the data from the various countries. So this is again the situation in the global. So you can see here that the estimated annual number of new cases for the 10 most common cancer in 2008. You can see here that in a high-income country, among males, the highest is prostate and lung. And then also the figure is the same. What about the female? So the female shows that the breast and colorectum is in high-income country, but in the upper middle is breast and lung. So in the lower middle-income country, the figure is different. However, if you look at this all, so lung is considered in every group in here in lower middle income country among male lung, among low income in the second highest, and for the female breast cancer and cervix uteri, and then also again this is cervix and breast cancer. So I think this figure is almost the same with Indonesian situation. So what about the diabetes prevalence? So you can see here that actually the global prevalence of diabetes is estimated to be 10%. So the highest is in the American region and Eastern Mediterranean, and mostly are in the lower and middle income country. So talking about the risk, actually there is a set of the major risks to health. So you can see here from the traditional risk, and then this is the modern risk. So here now the risk is completely shift from before in the past undernutrition, indoor air pollution, and water sanitation. But I'm not so sure, probably in Indonesia we still have this kind of risk factors. But at the same time, at the same time, the modern risk is also increasing, such as the physical inactivity and overweight, and also tobacco, which is very high. I think Indonesia is the highest, yeah. Abu Primaya. So this is about the leading health risk for the global mortality. You can see here that the leading global risk for mortality are with the red sign. Yes, the 5 figures is high blood pressure, tobacco, high blood glucose, physical inactivity, and overweight. And these 5 are responsible for raising the risk of chronic diseases. So if we look at again 8 risks, this is 5, and then high cholesterol, alcohol use, and low fruit and vegetable intake. So this account about 61% of cardiovascular death. So reducing this 8 risk factor would increase the global life expectancy about 5 years. So I think everybody knows about this iceberg phenomenon. So talking about the NCD, so reported NCD are only the tip of the iceberg phenomenon. So what about the risk factor burden? So there are two risk factors, behavioral risk factors and metabolic risk factors. However, some are unrecognized. But I think Indonesia we have some of the data, but not all. For example, like obesity is available in Riskesdas, and also this available. Tobacco, we have a lot of data. I think Pak Swartokosen and Ibu Prima will explain more. But unfortunately, about the alcohol is very limited data. And also for this blood glucose is only in several conducted only in several cities. So we know this for modifiable risk factors caused by major for NCD. I'm a bit not said because Professor Rainier said that WHO only talk about 4 diseases. So actually not only for diseases. We have a lot of guidelines for other diseases, but we focus on 4 major NCD because this is the most burden is there. So this we know already that tobacco, unhealthy and physical inactivity and harmful use of alcohol cause for these diseases 4. And there is other risk factors from environmental. We know already from this previous presentation about air pollution, occupational exposure to carcinogen, which is now still studied by some of colleagues in Indonesia, and also the infectious agent, HPV, and Helicobacter pylori. So I would like to show this is the causal chain. If we talk about the ischemic heart disease, so we can see here there is a direct risk factors, there is indirect, and then the most distal is the social determinant of health. So this change offer many entry points for intervention. Modifying of these risk factors have potential to yield fundamental and sustained improvement to health. So if we talk about the control, so we have to understand this causal change. So this is the NCD and poverty. I think we know that and the low medium income country has more exposure. Yeah, more exposure to the common risk factor. And then this is worse with globalization and population aging, like Indonesia now. The aging has become burden. In the past, if there is no action on that. And then the globalization, we cannot prevent from the McDonald's and then Kentucky and everything. So, but we have to understand about this. And then, sorry. So, unhealthy behavior, cause of NCD treatment, and limited access to effective and equitable health services lead to loss of household income. So, I think everybody knows that. We still have a lot. I still have 2 minutes more. Okay. So, I will run faster. And then this will be more burden if the person having NCD is the earner money. So this is intervention strategy. We know that these 3 pillars is very important for the prevention and control, surveillance to map the epidemic, and then prevention, reducing the level of exposure to risk factors, and then last but not least, we have to strengthen healthcare for people with NCD. So this is the loss from NCD. We can see that here is about 7 trillion. And then this is the best buy intervention. What is best buy? Best buy intervention is intervention that are not only high cost effective but also feasible and appropriate to be implemented within the constraint of the local low and medium income countries. So this is the list of the best buy intervention. For example, tobacco here there are 4, which is already considered as a best buy. Rice taxes is the very best buy. If we can increase the taxes on tobacco and then the tobacco use become decrease. So again, this is for harmful use of alcohol, unhealthy diet, cardiovascular disease, and cancer. So if we can do effective intervention to risk factors and then health system respond effectively and equitably, this will reduce 2/3 and then this one is 1/3. So on the NCD perimeter debt. So this is the guideline that actually this best buy we implemented in primary health care. So you can access to our website, the PEN package. And then this is intervention that cost effective for the diabetes. And then this is if we do the best buy and then is only 170 billion. So on the average is about 11.4 billion per year. So it's completely far from the cost if there is no intervention. So if you look at the best buy, so we cannot do alone, I mean from the health sector. So we have to include this media, civil society, private sector, and academia. And within government, there is a lot of regulation has to be established by the ministerial, for example, like food and agriculture, how to reduce the salt and processed food, and then for the education. And then this is what we have done so far. I mean, from WHO, you can see here that a lot of this is the key challenges. We still have a double disease burden, communicable disease, as this morning discussion. Do we have to move to save to the non-communicable disease? I don't think so. So we have to still consider communicable disease as a burden. And then low government budget for health. And then high out-of-pocket expenditure for health. Weak health system, lack of enforcement of law on paper only. So and inadequate information system. So WHO already started with the NCD action plan for 2013 and 2020 with the goal to reduce the morbidity and disability and mortality due to NCD. So we know what works, and then we know what it costs, and we know what that all countries are at risk. So we have to do this. So this is the regional action plan from the global action plan. At the regional Southeast Asia, we have this a bit modification. There are 4 priority actions: is health promotion and risk reduction. And then health systems and so this is the indicator to measure whether the intervention is achieved. So this is the target that has to be achieved by global, but this is as we can discuss whether we agree or not. It depends on the country. So, but for the regional, we have additional indoor air pollution target with a target 50% of reduction. So this is a conclusion. NCD's epidemic has a serious negative impact on the human development and create a significant burden on health and also economic burden. You can continue. Oh, I have to stop probably. No? Automatic stop. So this is the way forward that global and regional momentum generated for NCD with this UN political declaration. So it is now important to translate commitment to action, not only just commitment, because different. Probably it is different with tobacco. Commitment is in Indonesia, probably we haven't signed the FCTC, but we do a lot of action. And then at the country level, we should have a developed national and multi-sectoral action for the control and prevention of NCD. So now it's time for action. Thank you.
Thank you, Dr. Hernani. Before we start, I intended not to explain who she is, except she was my classmate. She is now as National Professional Officer from the WHO program in Indonesia. She was graduated from the school in 1979, same year with me. And she got his master MPH program from Mahidol University in 1991. She has a lot of experience in the Ministry of Health, especially the Directorate of EPA, right? Okay. And now I invited Dr. Prima Yosefin. She is graduated from Faculty of Medicine, University of North Sumatra, Medan. Wah, orang awak nih ya. She also graduated from Master Degree of Public Health from Indonesian University, Universitas of Indonesia, majoring in Health Economics and Insurance. She is representing Directorate of EPA and Directorate of NCD. Yeah. So please, time is yours, but sorry, only 20 minutes.
Thank you, Prof. Good afternoon, everybody. First of all, I want to apologize from my director because she cannot attend this an important seminar due to a hearing session with our parliament in Jakarta. Now I want to share to all of you about the health sector strategies to prevent and control NCDs from policy and strategies that already set from Ministry of Health. Yeah, for the background, I think Bu Hernani already explained very clearly, so I think we can next to the condition in Indonesia. Yeah, Indonesia faces many health problems, infectious disease, both old as well as emerging ones, and increasing burden of non-communicable disease like coronary diseases, stroke, diabetes, chronic renal disease, cancer, and obstructive lung diseases. Trend incidence non-communicable disease is likely to increase in the past of 2 decades, as well as injuries that have not showed significant declines. NCDs are the main cause of death in Indonesia, as compared to communicable disease and maternal and perinatal condition. According to the basic health research and household survey that conduct at 1995, 2001 and 2007, mortality caused by NCDs increased from 41.7% in 1995 to 59.5 in 2007. And a Global Health Observatory report of 2011 showed that cardiovascular disease caused the majority of death, around 32%, out of which stroke here at 15.4% was the leading cause of death among all causes of death in Indonesia. And Basic Health Survey 2007 revealed the 5 highest the 5 highest prevalence of NCDs in Indonesia were hypertension, and then joint disease, arthritis here, and then injuries due to the road traffic accident around 25.9%, heart disease 7.2%, and diabetes 5.7%. And basic health research also shows that only 23.9% of people with hypertension which diagnose and get treatment, while the remaining around more than 70% were undiagnosed and untreated because they never check their health to the healthcare facilities. This same as people with diabetes, only 26.3% of people with diabetes which diagnose and get the treatment, and the remaining more than 73% were undiagnosed and untreated. This cause people with NCDs is general come to the healthcare already in a state of severe disease. As we already know, there are 4 major NCDs risk factors, namely unhealthy diet, lack of physical activity, tobacco use, and harmful use of alcohol. These major risk factors, if not prevented, may lead to intermediate risk factors, namely hypertension, high blood fatty acid levels, high blood sugar levels, and overweight or obesity. Primary healthcare should early identify this risk factor, then prompt interventions can be performed to prevent NCDs or at least to reduce the complication of the disease. In Indonesia, based on Riskesdas 2007, as much as 93.6% of Indonesian people consume less fruit and vegetables. This graph shows no significant difference. So we can see it here of low consumption of vegetables and fruit in all ages of group, male and female, urban and rural communities, and the poorest and the rich people. Riskesdas also found that more than 60% of people eat high sugar content of food, 29% consume food high in salt, and 12% of high fat content food. And according to the Basic Health Survey 2007 also, obesity was more prevalent in urban areas as compared to rural areas. Overweight and obesity were more prevalent than wasting. Prevalence of obese and overweight among over 18 years old was 21.7%, more among women than men, and mostly in the fifth expenditure quintile. As per Basic Health Survey 2007, 17.5% and 4.7% of the adult population was overweight and obese respectively. This number increased to 21.7% and 11.7% respectively to the Basic Health Survey 2010. And according to the Global School-Based Health Survey Indonesia 2007, 1.8 school children were obese. Children going to school by car had more chance to be obese than those going by other modes of transportation. And this is the situation of tobacco epidemic in Indonesia. Globally, Indonesia ranked third after China and India in tobacco use. These figures shows that in 2011, the smoking prevalence in Indonesia is 97.4 for male and 4.5% for female. In other words, overall 61.4 million people in Indonesia are smokers. And prevalence of the smokers is significantly increasing annually. And then around 92 million are second-hand smoke. 43 million children are exposed, and 11.4 million among them are below than 5 years old. More than 200,000 died every year caused by disease related to tobacco. For the proportion and for physical inactivity, we can see here that 10% relative reduction in prevalence of insufficient physical activity. The research also states that 48.2% of Indonesia, so if we take the average here, age over 10 years lack of physical activity. The percentage is almost same in both rich and poor population. And when we see the challenges on prevention and control and of NCD, we have three challenges here. That is service disparity. Effort to control NCD haven't focused yet and fragmented. And limited access in rural areas and poor community to health services. And then the second is sectoral disparity or health system. The budget allocation of health is limited, not appropriate time and not proportionate, and health workers insufficient, untrained, and not enough empowered. And the third is for about policy disparity, sectoral programmatic distortion and excessive. Local government have not oriented yet to the program priority scale, such as MDGs, based on the planned budget. And to face of that problem, we already developed the strategy on prevention and control of NCD, and there are three main strategies to control NCD. That is surveillance, and then health promotion, and the last is health services. Surveillance on NCD are based on regular NCD survey. We have basic health research, national health survey, SDKI, Susenas, and etc. And then surveillance on NCD also based on NCD registry, that is hospital based, and based on health facilities. We know there is a Symposium shares from the hospital and laboratory, and also based on health research development. Now we still in process to develop a community-based NCD registry. And information that we got from this surveillance and registry were an evidence-based in conducting promotion and policy advocacy and NCD healthcare effort. For health promotion is done to mobilize organization and community group participate in controlling NCD, both in primary and secondary prevention. As we all know that the control of NCDs require various interventions that not only done by the health sector alone, but also by the other sectors. Intersectoral collaboration is needed in health promotion. For that, there should be strong leadership from the health sector to maintain intersectoral collaboration in order to achieve coordination in policy. If policy coordination has been achieved, then the health in all policy can be implemented. Currently, healthcare facilities have not been implemented an integrated health promotion related to NCD's risk factors, both at the primary healthcare facilities or in referral hospitals. Network across program and sector, including its mechanisms of action, needs to be improved now. And health services effort for NCD control is done through two approaches. We call it UKP, individual health effort, by carry out an integrated continuum of care by common risk factor control in the primary healthcare. This effort need to be conducted continuously since NCD is a lifelong diseases. And the second approach is the UKM, Upaya Kesehatan Masyarakat, community-based health effort, known as triple X. Triple X means active cities, the number one of active cities, encouraging region to be responsible for controlling NCD in terms of policy support, budget, and facilities. And the second act is active communities. Active communities is empowering community groups such as civil society group, Hajj, church assembly, a group of fishermen, professional organization, private industry, and etc. And the third act is active citizen, encouraging the ability of community by taking account of the characteristics, resources, and make their own health being healthier. The NCD prevention and control program will be more effective and less costly if the monitoring and control program start from earlier phase of disease occurrence. In order to increase high-level demand of community awareness of the NCD prevention and control, Indonesia experience and support the importance of having a community-based approach. Indonesia has developed a community-based intervention, namely Posbindu. There is an integrated activity on early detection for NCD risk factors, such as promoting healthy behavior through regular medical checkup, in particular with regard to NCDs, stop smoking, regular physical exercise, healthy diet, taking enough rest, and stress control. And in this picture, NCD program has three target of group population. There is the one is healthy population and risk population of NCD and people suffered from NCD. And in each target, we have separate activities, how to manage them. For the health population, we must give a health promotion health promotion to them, like a conducive environment, how to have a healthy lifestyle, such as no smoke, healthy activity, healthy diet, and so on, to keep their healthy status. And this activity could be done in that post-bindu and at community level. For the risk population of NCD, we have a intervention to integrated risk factors control. We have an implementation of NCD risk factors, like we must control their hypertension, dyslipidemia, hyperglycemia, smoke, obesity, and etc. And also we have a referral system here, and we can conduct this activity at primary health care and also at family doctors, so private practitioners. And for the people suffered from NCD, we have intervention to controlling the NCD and the complication. For the NCD, we conduct implementation of NCD cases. Also, the injury that we can take care of these people in the hospital, and after they already achieve their stable situation, and these people could be referral again to the primary health care, and we must give complication prevention and rehabilitation to them. Okay, and for all of this activity, we must have surveillance and registry of NCD. We must have recording and reporting about this. This is the primary principle of controlling of NCD in Indonesia. We want to enhancing community awareness and skill in of NCD risk factors prevention and control integratedly. So we have activity like learning by doing from and by and for community, and also based on local social culture, and as conductive social environment. And where we can do that, I already mentioned that we can do that in post-bindu PTM, we call it post-bindu PTM, the integrated post. Post-bindu PTM could be done at a house or school or workplace or public place. This post-bindu is making the early detection and counseling activity will be done through integrated risk factors monitoring in routine and periodic time. And what we can do there, we can do anthropometric measurement, blood pressure measurement, blood glucose and cholesterol measurement, health counseling and education for diet, for stop smoking, for stress, for physical activity and other health aspects. And also we can do physical activities together there. Okay, Pak. It's yeah, I think this already same like brief. And here I want to show you the regulation that we already have regarding to the maintenance for four common risks of NCDs. The first is with regard to tobacco control. Indonesia in 2012 introduced a government regulation which states that tobacco and tobacco products are considered as addictive substances and should be regulated to protect the health of the individual, family, community, as well as the environment. Based on this law, the government issued a regulation on tobacco control where the policy of production, protection of children, pregnant women, and non-smokers, as well as pictorial health warning on packages, supported by promotion and sponsorship of smoke-free zone. And here we also already have Health Minister Decree number 28 2000. Sorry, this is wrong. 2013, I mean, on pictorial health warning and health information on cigarette packaging. So we already have 5 picture that in next year, this pictorial health warning could be 40% of the surface area of a cigarette packaging must be must cover by this. So next year, the packaging of all our cigarette could be like this. We hope our community could be educated with this. That smoke is a very And then we are in relation with dietary factors control in the community. In April 2013, we introduced Health Ministry Decree number 13 on information and daily suggestion of sugar, salt, and labeling for processed and fast food. Now we still in socialization process this regulation to media and food industry until April 2016. So sugar, salt, and fat reduction with public consumer education through Health Minister regulation on sugar, salt, and fat consumption, focusing on empowerment of food labeling and health message. And also, we already have policy that exercise is also a medicine. We have a special exercise for post-stroke people and for osteoporosis people and etc. Yes, this is the summary. Indonesia faces today is the triple burden of diseases, and NCDs are the most common cause of death worldwide and in the Southeast Asia region. NCDs exacerbate household poverty and threaten national economies. NCDs can be prevented by reducing common modifiable risk factors through cost-effective intervention and developing and strengthening the community-based health service activities, increase the participation and empowerment of the community in NCD risk factors control. We call it Posbindu, and multi-sectoral action is key in prevention and control of the NCDs. Maybe that's all from me. Thank you, sir.
Okay, we still have 15 minutes for discussion, and we are inviting any questions or comment from the audience. Yes, in the middle, 1 and 2 and 3. Yeah, 3 questions. Lady in the middle, please.
Yeah, good afternoon. Firstly, I want to apologize for my poor English. My name is Gerardine. I want to comment about two-third NCD in Indonesia unrecognized. On July and August this year, I'm as a validator for Riskesdas 2013, and I conclude most of people, especially in rural area, didn't know the definition and symptoms of NCD, such as high blood pressures. And they also never go to healthcare facilities even once because they think if they still can work, then they are as healthy as horse. So what do you think about this? Then, and until now, what a real action from Ministry of Health for health promotion about NCD, especially in rural area? Thank you.
Thank you, Geraldine. And next, right? Yes.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Dan selamat sore. Ya, mohon maaf sebelumnya kepada seluruh peserta di forum ini karena kali ini saya tak mampu menciptakan suasana yang sifatnya westernalisasi yang sudah lama terbangun sejak pagi tadi. Tapi iya, maksud saya seperti ini bahwa saya hadir untuk tidak menafikan suasana yang telah teman-teman bangun, suasana westernalisasi yang saya maksud. Tapi lebih kepada terus terang kapasitas kemampuan bahasa Inggris saya yang di bawah rata-rata. Ya, tapi saya mencoba berangkat pada substansi komunikasi bahwa tujuan utama berkomunikasi bagaimana antara komunikan dan komunikator dapat memahami kegelisahan yang saya maksud. Iya, sederhana. Maksud saya seperti ini. Saya yakin teman-teman di sini sama dengan apa yang saya rasakan. Teman-teman juga sebagian merasakan kegelisahan yang sama, tapi mungkin belum sempat atau belum mampu hadir dan belum mempunyai keberanian untuk bagaimana mengaktualkan kegelisahan tersebut dalam bentuk tanda tanya.
Karena waktunya sudah banyak untuk yang lain-lain, langsung saja ke pertanyaan.
Terima kasih,
please,
Pak.
straightforward for the question, please.
Jadi berbicara tentang konsep disease atau konsep penyakit, saya rasa teman-teman sepakat ketika berbicara tentang sakit itu adalah tercipta karena ketidakseimbangan antara konsep agent, host, dan environment. Iya. Jadi menyimak tentang materi non-communicable disease atau penyakit tidak menular, kalau menurut kacamata saya ini juga terjadi akibat konteks ketidakseimbangan tersebut. Ketidakseimbangan yang saya maksud adalah ketidakseimbangan dari apa yang disebut dengan efek neoliberalisme atau globalisasi yang seperti Ibu paparkan tadi. Kalau saya kutip bahasanya David Harvey, ini adalah sebuah fenomena dari yang disebut the condition of postmodernisme atau kondisi pasca modernisme, atau yang biasa diistilahkan juga adalah sebuah fenomena dunia yang dilipat atau pemadatan ruang dan waktu. Kondisi pemadatan ruang dan waktu ini kemudian secara tidak langsung menciptakan sebuah masyarakat yang manja dan sifatnya konsumeristik. Mungkin dahulu kita masih
mohon maaf, waktunya sangat pendek. Tolong straight, apa komentar untuk presentasi atau pertanyaan untuk yang bersangkutan?
Iya,
jangan memberi kuliah lagi, kita sudah capek sore hari.
Pertanyaan saya mungkin saya simpulkan bagaimana kira-kira strategi yang kemudian dihadirkan untuk menyikapi kondisi globalisasi saat ini. Terima kasih. Yang kaitannya dengan efek non-communicable disease.
Terima kasih. So the question is how to make a good strategy in respond to globalization, which related to NCDs and so on. That is question. That is question. Sebelah kiri, silakan.
Ya. Terima kasih. Semoga tidak ada konspirasi hati dalam pertanyaan saya ini. Okay, thanks for great presentation from both speaker. But I have some comments here. First, for both of you, did you consider mental health as part of NCDs? Because my name is Martunis and I'm working in mental health fields. So did you consider mental health as part of NCD? Because this morning we heard that they put it as NCD plus whatever they say it. So because I have seen your presentation, but I couldn't find I couldn't find it. I don't know. So please give your comment. And for Ibu from WHO, you talk about the cause of death, but how about the quality of life? How about the daily? Because if you consider daily or disability adjusted life here, depression alone will lead disability by 2020. So what do you think of that? Thank you.
Okay, I think start with Bu Hernani. Can you respond to those three questions? Because please, very short time is. Yeah. Okay. So for you, which one of those three?
Thank you. I think it's good question about the globalization. So it is already mentioned in my presentation that actually there are a lot of strategy that has been done that has to be done by the countries to overcome the globalization. For example, if the people understand about the cause of the disease, and then they realize that they have to be healthy lifestyle, for example. And then even the globalization such as McDonald's or Kentucky, all over country. So since they know already that this is not good quality of food, so they will change the behavior. So the second one should be the regulation, in my opinion. So the regulation, I think a lot of regulation has been done by the Ministry of Health related to this. For example, like sugar, salt, and fat. This is exactly has a lot of comment at the global level, because the industry, especially the food industry, will hamper on this regulation. So, however, the regulation, I mean, the Ministry of Health, the government of Indonesia gave time to give time to the factory to change their content of the food, processed food. The second one about the daily, yes, exactly. Actually, the WHO calculate in the daily, but I didn't make a presentation here. But if you want, you can see in the global report. So there is a lot of daily calculation on that. So you can just visit the website of WHO and then you can see. Yeah, I think.
Yeah, thank you for the question. For the health promotion, especially for the rural area, I think I already mentioned that from Ministry of Health, we already developed a strategy to make community to increase community awareness for the NCDs. So through this Posbindu, we can give the education, we can give the counseling directly to the community. So we hope they already know how to prevent their healthy, how to or also to promote they as a promotion to the other people from their community, like this. We realize that our strategy or maybe our policy not yet enough to cover our problem, because we know that Indonesia is very wide, and also we now have an decentralization era. That from just if the strategy or policy just only come from the Minister of Health without the collaboration with the local government, it cannot be happen like that. So to increase the health promotion, we need the collaboration, intersectoral collaboration, so we can expand our promotion to to all of our population, especially for the rural. And also we already have we call it iklan layanan masyarakat for the NCD, but just I think a small time. And for the hypertension people that never come to the health facility because they feel they're not sick, because they can do their activity, daily activity. I think that's happened in our population. That's why when we celebrate World Health Day last April, we already launched blood pressure measure for all. So we already asked our colleagues at the private health puskesmas, the puskesmas, to measure every people that come to the puskesmas, even there no headache complaint or that, but every person that come to puskesmas must be take a high blood measurement like this. Maybe from that we can decrease the hypertension that undiagnosed and untreated. And for the strategy for globalization, I think Bu already mentioned. And for the mental health, yeah, until now the NCD program in Minister of Health just only no prevention. Just only covered for 5 main disease of NCDs, just for cancer, and then cardiovascular disease, and then chronic and degenerative disease, and then diabetes and injury. Just only that. So for mental health, covered by our colleagues in BUK, Bina Upaya Masyarakat Health Services program. That's happened. That's why from the beginning of our strategy and policy, I not mention about the mental health. Thank you.
Okay, you want to put?
This is regarding mental health. Actually, WHO already started with I think in last year meeting in one meeting talking about the NCD and mental health. So we try to include also some of the aspect of mental health, because if you talk about mental health, usually they talk about the psychosis. So that's why it is a bit far from NCD. So, however, we also try to put alcohol, because alcohol is also a part of addiction, a part of mental health, included in the NCD. So.
Before I'm closing this session because of the time, it's already 5 minutes, almost 5 minutes over from the schedule. I would like to summarize it in very short, mostly in Indonesian. Pertama, kita sudah menyaksikan ancaman terhadap peningkatan baik proporsi atau yang lebih penting sebenarnya jumlahnya, tidak hanya proporsinya, karena harapan hidup kita naik dan sebagainya, terhadap penyakit-penyakit non-communicable disease. Strategi global dan regional tadi disampaikan oleh Bu Ernani. Strategi nasional Departemen Kesehatan sudah disampaikan Dr. Prima. Dan implementasi semuanya sudah disampaikan every intervention that has been presented is very, very ideal. You may just wonder whether there isn't real activities that provide impact or not. Itu sesuatu hal. So for you all, especially students who are working in public health, this is your new breath of activities in public health, because in the past many public health workers in Indonesia mostly concentrated on infectious diseases. Nowadays, you don't leave the infectious diseases behind, but still you have to add new additional activities, which is in NCD. Tentang globalisasi, regarding the globalization, many people thought that, I put it in the title, globalization is the bad and the ugly of globalization. But I disagree with that. I think there are the bad, the ugly, but also the beauty of globalization. So, because the advantage of globalization is that now there is no boundary of sharing knowledge. There is no boundary of sharing technology. But, of course, the cultural adaptation, adaptasi kultural, membutuhkan effort, need a special effort, which in the end, cultural adaptation is not danger your healthy life. Most globalization that has been adopted sometimes influence your healthy life, which is inconsistent with many cultures in this Indonesia. I think once again, let's give a big applause to our two speakers. And I'm sorry I have to close this session, and I will give the time to the organizing committee. I thank you for that.
Thank you, Professor, and representative from WHO and Ministry of Health Indonesia. Before we continue our session, I would like to invite you for the next 20 minutes for tea break, but I would like to add some information related to poster presentation. Poster presentation will be held tomorrow at 10:10 a.m. in two sessions, 9 posters each in panel, 5 minutes per each presentation. Special for the poster presenter, we would like to invite you to check the schedule and submit the soft copy of your presentation to the registration desk outside, or you can send via email to rahmahangia@gmail.com. Thank you. May you all enjoy the tea break. We will joining this room to continue with our fourth presentation 30 minutes after now. Thank you very much.